and welcome back to Time with Lydia, the pharmacist. Today we are diving into a common condition, itchy mosquito bite. And I'm going to be sharing with you some tried and tested remedies. We'll be looking at some natural remedies as well as some over-the-counter pharmacy products that you can apply when your skin gets itchy after a mosquito bite. So I've got you covered. If you've been scratching away, then stay tuned. Remember to like, subscribe, and hit on the notification bell so you don't miss any of our informative content. Now, the first and simplest remedy for an itchy skin caused by a mosquito bite is the use of a cold compress. There are various ways of making a cold compress, and I'm going to show you 4 simple ways of doing this. The first one is to get yourself an ice pack, wrap it in a cloth, and then apply the cloth to the itchy area for about 20 minutes at a time. You can do this a few times in the day. The second way that you can make a cold compress is to get a clean cloth and run or soak it under cold water. Rig the water out and then apply the cloth to the itchy skin for about 20 minutes. This is very good, especially when the skin is swollen. The third way that you can make a cold compress is to get a clean cloth, wet it, and then keep it in the freezer for about an hour. Take it out and then apply it to the itchy skin for a few minutes to get some relief. Now, the final way that you can make a cold compress is to apply the ice cube directly onto the itchy skin. Do this for only 30 seconds at a time, and you are sure to get some relief from the itchiness. Number 2, when you get bitten by a mosquito and the skin gets very itchy, it is very important that you find a way to stop the itch-scratch cycle. When your skin gets itchy and you scratch, the skin gets more irritated. Scratching can cause more irritation of the skin, and this will prompt you to scratch even more. But as you scratch, you can break the skin up, and this can put you at risk of introducing a bacteria or a virus into the skin. And when this happens, it means you are at risk of developing an infection. You can avoid excessive scratching by wearing a trousers or a pants or a long sleeves shirt. Also, it is very important that you always keep your nails short so that even when you have the urge to scratch, and you avoid breaking up the skin. And number 3, you can try pharmacy products. If you develop any pain as a result of the mosquito bite, you can take ibuproden or paracetamol, and you can get this from your local community pharmacy. And make sure that before you take any of these, you speak to your community pharmacist for advice. To relieve the itchiness, you can use an antihistamine, and it is best to get a non-drowsy antihistamine tablet. Examples are cetirizine and loratadine. You can purchase these from your local community pharmacy. A steroid cream, for example, Hydrocortisone 1% cream, can help with the itch as well as if there is any swelling. There are also other creams in your local community pharmacy that you can purchase to help relieve the itch. Examples are E45 itch relief cream. You can also get aqueous calamine cream or calamine lotion or menthol cream, and all these are available to purchase from your local community pharmacy. These products can all help provide some relief from the itchy skin. Anytime you get stung by an insect, for example, if you get stung by a mosquito and you start developing the following symptoms, it is very appropriate that you report to your doctor. When you start experiencing some lightheadedness and dizziness, when you develop a high temperature and a swollen gland, when a large area around the bite becomes red and swollen, when you get stung in your mouth or in your throat or around the eyes. When your symptoms get worse or are not getting any better, even after trying home remedies and pharmacy products. When you get stung more than once, and when you start experiencing stomach pain and vomiting, and also when you've had a serious allergic reaction after a mosquito bite or an insect bite before. All these call for you reporting to your doctor as soon as possible. I hope this content is beneficial. Please don't go away without giving this video a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our informative content. Leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next one. Bye for now.